Hello guys, how are you? Hope you are fine. Please subscribe my channel for more top best health and fitness tips. Thank you. Today the topic is top best and latest research what causes of heart attack in the world. Most people know that having a heart attack is not good for you. But did you know that the causes could be different from person to person? This post will explore some of the major factors that may cause a heart attack, along with the symptoms, how to detect these conditions, and when it's better to see a doctor. 1. Smoking. Smoking is one of the most common risk factors for heart disease. According to the American Heart Association, AHA, cigarette smoke contains harmful chemicals known as carcinogens. These can damage blood vessels and increase your risk of developing heart disease. A 2018 study from Harvard University investigated the relationship between smoking and coronary heart disease in over 200,000 Americans. Researchers discovered that people who smoked more than 5 cigarettes per day were at higher risk of having a stroke or dying from heart disease. Additionally, women who smoke more than 100 cigarettes per week are also about 3 times as likely to have a premature death from heart disease as men who smoke. 2. Obesity. Being overweight or obese increases your risk of heart disease, particularly if you have high blood pressure or diabetes. People who are underweight are 1% more likely to develop cardiovascular diseases than those who are overweight. However, being underweight is just one factor that influences your risk of having a heart attack. Other studies have shown that being underweight may even lower your chances of getting a heart attack. In addition, obesity-related fatty deposits on the walls of blood vessels, called atherosclerosis, may make it easier for cholesterol to move from your blood to your arteries, making it harder for the arteries to flow easily. High blood pressure, on the other hand, puts additional stress on blood vessels. Over time, this buildup can lead to narrowing of the arteries, which may then increase your chances of a heart attack. 3. Stressful situations can significantly raise your risk of heart disease. During stressful events, such as work or financial difficulties, your body releases cortisol, a hormone that may increase your risk of inflammation, insulin resistance, and heart disease. When faced with high levels of anxiety or depression, your body may not be able to properly regulate its response to stress. Your risk of experiencing these effects goes up, including a heightened risk of heart attack. According to a 2017 study published in Clinical Therapeutics, chronic stress increases your risk of developing hypertension, which also increases your risk of developing heart disease. So if you find yourself struggling with stress, contact a therapist to learn ways to manage it. 4. Fatty liver disease. The fat and protein metabolism in the liver can impair blood flow and increase your risk of developing heart disease. A 2014 study conducted by researchers from Johns Hopkins Hospital found that patients with non-alcoholic fatty liver disease, NAFLD, had a 2 to 3-fold higher risk of having a heart attack compared to people without NAFLD. They also reported that the severity of their symptoms went up with their condition. Those diagnosed with NAFLD were nearly 3 times as likely to die from sudden cardiac arrest compared to people without NAFLD. 5. Diabetes mellitus. Diabetes is a metabolic disorder that occurs when your blood sugar levels become too high. Because your body cannot produce enough insulin to control the amount of blood sugar taken in, your blood sugar levels remain elevated. As a result, you experience frequent periods where your blood sugar becomes dangerously high. You are at a greater risk of developing blood sugar levels that can put you at higher risk of developing heart disease if you don't take steps to manage your condition. Diabetic individuals who smoke or drink alcohol have a 50% greater risk of developing heart disease compared to healthy people. 6. Hypertension. High blood pressure affects many aspects of your health, including your heart health. While some people may assume that high blood pressure doesn't affect their quality of life, high blood pressure is linked to several health problems. Studies show that heart disease can occur earlier in older adults who suffer from high blood pressure because they are living longer. Additionally, heart attacks are less likely to occur in older groups. According to the National Heart, Lung and Blood Institute, high blood pressure is the leading cause of heart disease deaths. Cardiomyopathy. Cardiomyopathy is a condition that affects your heart muscle and makes it harder for it to function effectively. This can lead to poor blood flow to your heart and other organs, raising your risk of developing heart disease. Conditions such as congenital heart failure, arrhythmia, cardiomyopathies, heart valve disorders, and dilated cardiomyopathy can all lead to heart disease. To prevent heart disease, talk with a doctor about the treatment options available. 9. Type 2 diabetes. Type 2 diabetes is a form of diabetes that occurs when your body does not respond adequately to insulin after you first start taking it. Your pancreas produces insulin to give your cells the energy they need to function properly. Once you stop taking insulin, your body will not have any insulin left. This means you'll continue to struggle to control blood sugar levels. Some people are born with this condition and need to treat it with insulin shots. Others have prediabetes, which means they have blood sugar levels that are slightly elevated but not high enough to be diagnosed as type 2 diabetes. Treating diabetes requires a combination of medication and exercise. 10. Congestive heart failure. Congestive heart failure is a medical condition that occurs when there is not enough oxygen reaching the tissues in your body. After a heart attack occurs, the lungs fill with fluid to try to make up for the lack of oxygen. This creates an imbalance of oxygen in the blood. This is why people with congestive heart failure are at higher risk of having a second heart attack. Symptoms include shortness of breath, chest pain, heavy sweating, and fatigue. Treatment includes medications, surgery, or both. 11. Kidney stone. A kidney stone is a small organ that is located in the kidney. It happens because of a buildup of stones in the urinary tract. Many people tend to ignore it, but when it causes pain, discomfort, or even loss of appetite, it is worth seeking treatment. Stones are typically removed through surgery, but in rare cases, they may need to be dissolved using medications or radiation. Depending on the size of the stone, the risk of complications is much lower. It's essential to visit a healthcare provider to ensure you do everything right to prevent complications from occurring.